So I propose that we start. It's nearly 5 minutes past, so I would like to welcome you all today to this seminar on age-friendly public spaces in African cities. So for today, we have two amazing guests that are bringing to the table various years of experience working in the field of urban health. And we're very, very happy to have them available. They're here online. It's Dr. Tiago Henrique Dessau. Hi, Tiago. And Ayanda Roji, who's joining us from Johannesburg. So for the next hour and a half, we'll be talking about different challenges and opportunities related to cities and what it means to have age-friendly cities and inclusive cities, and what this can mean in different contexts. The way that the webinar is structured is it will be in two parts. So we'll have the first part where our speakers will present their points, their experiences, and potentially some case studies. And in the second part, we will have a networking session where you will be able to meet each other and be able to discuss on the topic, after which we will meet for a plenary. Of course, there's some space for questions and answers. So after the speakers have presented, we will open the floor and you will be able to ask your questions either by opening your camera, stating your name and your affiliation, or through the chat, and we'll be able to monitor that. So great. I would say let's start. Without further ado, I would like to maybe ask Sydney to run the poll, Sydney, just so that we have an idea of who's in the room. So over to you. Great, thank you very much. Sydney, is it okay? Can I go on? Great, thanks. So as we collect the results, we'll feedback you the results as soon as we can. So starting off, without further ado, I would like to introduce Dr. Tiago Henrique Dessau, who I've known for many years now, because he's been very active in the field of urban health and transport and environment and climate. He is the technical officer working in the Department of Age-Friendly Environments, the Department of Social Determinants of Health at the World Health Organization. Dr. Dessau has a very interdisciplinary background in sports sciences. He has a PhD in public health. And starting his career as a physical educator, he then moved on to academia before joining WHO. Dr. Tiago Dessau has been working with the Department of Social Determinants of Health for over a year, focusing on age-friendly environments. So welcome, Tiago, and take it away. Thank you.
Thank you, Milan, and thank you, colleagues. Thank you for the invite. It's a great pleasure to be here to this event of the African Urban Health Community of Practice of the International Society of Urban Health. It's also a great pleasure to share this panel today with Ayanda Roji. And I would just like, before starting my intervention, to highlight the great work of these brave, bright, great women that are leading the agenda, as you can see in the organization team, but also in the panel today. So for me, it's a pleasure, it's an honor to be here. Milan said it all. I am leading the portfolio on age-friendly environments for a year now. Before, I led the portfolio on healthy urban environments, still from WHO HQ, and I work closely with colleagues in the regional and country offices to try and make the lives of older people better, dignified, meaningful, as we advance with urbanization and many other major trends. So I am supposed to run a presentation now, so I will share my screen with you. And I hope that you can see it in full screen mode.
So we can see, yeah, now we can, perfect.
Now you can see it, correct?
Yes, in presentation.
Great, so let me just adjust a few things here. While I do that, I just wanted to highlight that this presentation will be made available. So please do not spend too much time taking notes, because we can certainly share these afterwards with everyone registered in the meeting. So today the idea is really to talk about age-friendly public spaces in African cities, the challenges and opportunities. Of course, this is a critical aspect for WHO, and in particular for our global network for age-friendly cities and communities, which takes most of my time in the portfolio I lead. But before jumping into the business, I would really like to give us some initial remarks as to why this is important and where we are in terms of the global context for this area of work. Starting with these two graphs that you see in front of you, and here I would like to highlight some great news. We, as human beings, are succeeding to live more. And this is amazing. This is actually a great achievement. We are managing to add years to life. As you can see in those graphs, for both women and men, if you look at the lines with balls as marks. So for both women and men, in terms of life expectancy, but also at birth, but also life expectancy at age 60, you see that we are globally managing to add years to life. This is excellent. At the same time, we're still not living healthier lives fully. Otherwise, if that was the case, you would see the lines marked on squares overlapping the lines that I've just shown you before, meaning that every single year lived was a healthy year. So there's a gap between these two lines. And actually, this gap is even widening. So that is to say that while we have managed to add years to life, we haven't yet managed to add life to years. And this is the challenge we face today. Of course, a lot of that, actually the best way to do it, to enable life to be added to these additional years we as a society are managing to get, is by intervening in the environments we all live in. And by environments here, I think it's important to highlight that we are not just talking about the physical environment or the natural environment, but we refer to all the factors in the extrinsic world that form the context of an individual's life. So a nice way to think about it is anything that is outside your skin. So it's the built environment, but also the people, the relationships between people, attitudes, values, the social environment, the health and social policies that you have in place, the systems that support them, the services that they implement, and so on and so forth. So it's everything that falls outside your own body. And what is then an age-friendly environment? Well, it's an environment that enables all people to age well in a place that is right for them, and it is for them to decide what is right for them, to continue to develop personally, to be included in society, to contribute to their communities if they wish to do so, and to enjoy independence and good health for the entire period of their lives. What you see on the left-hand side are the domains of functional ability. I will not get into details here, but functional ability is the result of our intrinsic capacities, the capacities that we have in our body, together with the environment. So in a nutshell, you may have some reduced capacity of seeing, but then the environment provides you with a glass and your functional ability of seeing is kept. So just a very simple explanation of what that is. So for functional abilities, we would hope people through age-friendly environments to be able to meet their basic needs, contribute, build and maintain relationships, be mobile, learn, grow, and make decisions. And as you can imagine, age-friendly environments is not just about older people. It benefits all community members because it helps remove physical and social barriers while also fostering inclusiveness, not just in terms of population groups, but also benefiting people living with disabilities, people living with dementia, because of course, when you improve accessibility for older people, when you address gender inequities, that also works for a larger share of the population. Same as for when you build resilience for communities to address emergencies of different natures. Creating age-friendly environments is also one of the 4 action areas of the UN Decade of Healthy Aging that started in 2021, and we are now under the UN Decade of Healthy Aging, which is also aligned with many other major global agendas, including, of course, the 2030 Agenda for Sustainable Development. The UN Decade of Healthy Aging is also a commitment by all member states, all countries, to improve the lives of current and future generations of older people. Now, how we then develop these age-friendly cities, these age-friendly environments? Well, we've seen throughout the years that developing age-friendly cities and communities is a proven way to create age-friendly environments because they improve access to key services, and they also enable people to be and do what they value. And in order to implement an age-friendly city or community, what we have listened from all the people themselves from around the world in a large consultation that WHO developed back in 2007 was that we should intervene in at least 8 domains. And what you see there in this beautiful flower are the 8 domains of action: housing, transportation, social participation, respect and social inclusion, civic participation and employment, communication and information, community support and health and social services, and of course, outdoor spaces and buildings, which will be the focus of our discussion today. But as you can imagine, those domains of action, they don't operate in isolation. If we talk about outdoor spaces and buildings, oftentimes we are intervening on them to increase social participation. If we intervene in transport, oftentimes because we want to also ensure that people have access to health care services. So we should not see them in isolation, but rather integrated as part of the framework for creating these age-friendly cities and communities. How exactly this will lay out in different places will very much depend, because the context is different. And at the end of the day, as I've just said before, the fundamental to the age-friendly process is the leadership and the meaningful engagement of all the people in planning, implementing, and assessing whatever intervention that we put in place in the domains that all the people themselves see as a priority for them. Now, the benefits of implementing this framework have been demonstrated throughout these years, since 2007, when WHO released the Age-Friendly Cities Guide, and also since 2010, when we launched the Global Network for Age-Friendly Cities and Communities, which now has over 1,500 members across 51 countries from all around the world, all committed to becoming more age-friendly. So what you see there for each orange dot is a city or a community. And here it's important to highlight that we're talking about from very large cities, such as New York, to very small rural communities in the countryside of Canada or Chile or Australia, because we really want to make sure that whichever sort of human settlement you live in, that this space is age-friendly. Also on that graph, you see some countries highlighted in light blue, and those are the ones where we have at least one member. In dashed blue, those are subnational programs for age-friendly cities and communities. So if you look at the example of Australia, there are two states in Australia where we have subnational programs, as well as in Quebec, as you can see in Canada. And in dark blue, we have countries that already have a well-established and functioning national program that are affiliated to the global network. And these people do an amazing work. They are the ones really supporting their cities and communities to become more age-friendly, and I'll go back to that at the end of my presentation. If you go to the webpage of the Global Network, and I'll be happy to share the links with you afterwards as well, you will see that for each member and affiliate, there's a profile page containing relevant information and documentation on their age-friendly cycles. So their strategy and action plan, the baseline assessments they've done, the final assessment as well that is informing the next cycle. But you also have the chance to see a lot of the age-friendly practices that each member is actually putting in place to transform their environments into better places for us to grow older in. You will also have access in most cases to the contact details of the focal points of those cities and communities. So if you are interested in what they are doing, you have there an opportunity to reach out directly and exchange, because the mission of the Global Network is precisely to connect people committed to become more age-friendly, to inspire and get inspiration from everyone, and to provide the technical and the support that people need to actually advance on this journey. Now, as many of you may have noticed already, the African continent currently has no member or affiliate in the WHO Global Network for Age-Friendly Cities and Communities. And is that one of the reasons why we are here today, because one of the strategic priorities for us is precisely to try and bring the global network and the commitment for all cities and communities and countries to become more age-friendly to places where this agenda is less advanced, is less taken, while at the same time using the great opportunity, because I'm sure that a lot is already happening, right, to tap into existing innovative initiatives that the global network could get inspiration from. Who can join the global network then? Well, any city, community, or subnational level or of government from one of the WHO's WHO member states. That city or community can apply directly, currently in French, Spanish, and English, through the link that you can see there. And basically what it takes to be a member of the global network is the commitment from the highest political authority. Oftentimes we call it a mayor. Sometimes these definitions change, but we need a signed letter from the highest political authority, the commitment to use a common methodology, which is the one that I've just shared with you, that is being replicated by every single member over these years, and the sharing, including the submission of at least one age-friendly practice annually to our global database, just so that people can get inspiration from the work that is being done there. So here you can see that joining the global network is by no means an accreditation of age friendliness, but rather a political commitment to work in that direction, to continuously try and become more age friendly. I've mentioned the age friendly practices. We actually have a very nice, I'm biased here, of course, but a very nice global database of age friendly practices. And it's perhaps one of the best parts of my job, which is to screen these applications and have a look of all the great things that people are doing, very concrete activities to make their communities better places to grow older in. And we have a lot in there. And we have a lot on outdoor spaces and buildings, of course. And these are not just led by local authorities, but also national authorities, civil society organizations, older people's associations, professional associations, academia, media. So I do invite you to have a look at the database because it's quite inspiring. When we talk about outdoor spaces and buildings now, and if we want to have a 360 look of what an age-friendly environment should look like. And maybe a good way to look at that is the example that we have here in this slide of this older person actually wanting to go shopping, right, to buy some food. So if we are serious about the age friendliness of outdoor spaces and buildings, then there's some questions we may ask ourselves in these very trivial and fundamental part of a daily living, right? Is this person's housing accessible? Like, is housing in this space accessible in the first place? Is the household this person lives adapted for the current status of intrinsic capacity the person has? Do we have accessible buses or taxis or any other form of public transport in this area? Do we have footpaths, pedestrian crosses available throughout this journey? Is the neighborhood a pleasing and safe environment? Do we have benches on the way or public toilets on the way, just so that people can rest if needed? But then once you get to that shop, is the shopkeeper helpful, friendly, non-ageist? So as you can see, it's a need of a very comprehensive look, including several sectors, to make sure that this simple activity, but fundamental activity of life is age-friendly. Now, I also took some examples from the global database, just to give you a snapshot of what people are doing and how innovative these ideas are. And I'm sure that now we have a lot in Africa that we could also have in the global database to inspire others. One example that I find particularly interesting is from Ennis Age-Friendly Town in Ireland. They run walkability audits. So they get older people and persons with disabilities to walk together with the urban planners. So they go and walk together and they say, this is working, this is not working. We need a bench here. This footpath is perhaps not ideal. And then once that assessment is done, an action plan is devised, and then measures are introduced. So this is a very interesting example that I find. Another example is coming from a national program, one of the affiliate programs of the Global Network, which is the Réseau Francophone des Villes Amies des Aînés, now the Francophone Network for Age-Friendly Cities. They have a support fund for innovative senior territories. So what they do is they transfer some seed funds for the communities to organize themselves. Then the community organize themselves. They decide, they produce a transversal inventory of the territory. So it's in the way that they do an assessment, an initial assessment through a participatory approach to identify the needs and aspirations of all the people in all the domains I've mentioned. And then they come with a second tranche of funds for the creation of projects in the territories that will actually address the needs and aspirations that have just been identified. And here you see a concrete example of an affiliate program supporting cities and communities in their journey to become more age-friendly. A third example, again, from a national program is coming from Ireland, which is the Healthy Age-Friendly Homes program, which I find fascinating because one repeated concern that all the people had there was that you had all these different services from the municipality coming to them in a non-coordinated manner. So it's not that they were short of services, but it was really uncoordinated. So this national program really aimed to support all the people to live in their own home, aging in place, with dignity and independence for as long as possible. And to do that, they would do a needs assessment to identify what exactly would be needed for that to be put in place. And they have a series of measures that refer to the services I've just mentioned, concentrated in a single program, ranging from right sizing your house, your children left, then you may not need a house that big anymore, tenure rights, so how you organize the paperwork, but also infrastructure adaptations on the existing home, access to a range of housing, health, and social care. So how can we ensure that health, social care reaches those in their own homes? So a full range of activities that can be put in place through a program like that. Now, a lot of people may think that, oh, this is a high-income country thing. We need a lot of resources to do that. And this is really not true. And I find particularly interesting the guidance that my colleagues from PAHO, from the Americas, have developed jointly with Help Age International and AARP. And by the way, AARP runs the national affiliate program for the US, for the Global Network. That guide was called Let's Go, 28 Bright Ideas of Low-Cost and Easy-to-Implement Interventions. I would really invite you to have a look at the guide. It features a step-by-step on how to make your city and community a better place to grow older. It has those ideas and also tools for raising awareness and campaigning for the rights of older people. And I can tell you, some of the affiliate programs that I've mentioned are run by 1 or 2 people at the country level. So it's really not necessarily about having resources, but it's having the right mindset, the right framework, and the right allies. I will go quickly here, just to flag to you that, of course, you may have seen in my examples that national programs are really one way for countries to accelerate the development of age-friendly cities and communities. And precisely because of that, and because this is reflected in the action plan of the UN decade, WHO has just released a new guide and an accompanying toolkit to support countries in developing national programs for age-friendly cities and communities, adding to the cities guide that we have already developed back in 2007. So there you have a practical step-by-step framework, detailed case studies, and key contacts for support. So I do encourage you to disseminate this. If your country is interested, if you have contacts, please do not hesitate to make it reach their hands, and WHO will stand ready to support the implementation. Other than that, I would just like to thank once again. For those interested, I would really invite you to have a look at these 2 QR codes where you can have more information and materials as regards to the guide I've just mentioned, to the Global Network, and to all the great work that is being done throughout the world when it comes to age-friendly environments. Thank you very much, Milan. That's me. The ball is back to you.
Great, thank you. Thank you so much, Tiago. Or Dr. Eric Desai, if I stay formal, for this excellent presentation around age-friendly cities and the amazing work actually that has been going on for more than a decade, even if I know that the Twitter handle UN Decade of Aging, it's been several decades actually of success. And I think there's a lot to be learned from the approach that age-friendly cities has taken, especially the emergence of other types of movements like smart cities and healthy cities and all of the rest of the cities. I will be excited to hear some questions and discussion around your presentation, but we will keep that for the end, if that's okay. While we are now having a break between the 2 presentations, I'd like to take 1 minute to acknowledge the new arrivals. I know a couple of people have joined, so welcome to this networking webinar on age-friendly cities. If it's your first time coming to one of our webinars, we are organizing this as a team. So we call ourselves an action group because we're focusing a lot around knowledge exchange and how to build practices around urban health. And the whole crux of this team and community of practice is for us to be able to find opportunities together, meet each other, and open up the urban health field to different types of practitioners. So we're still in our first year of operations, and we're now trying to expand to different types of actors, so academia, but also industry actors, private, NGO, multilateral experts like Tiago, government representatives, and urban practitioners like Ayanda. So before I introduce Ayanda properly, I would like to invite all of you who are on call to maybe put your email and your name in the chat, to stay and network right after the sessions. By putting your name and email, you can join the community of practice to receive updates not only about our webinars, but all the different types of webinars around urban health that we're connected to, but also for you to receive updates on different opportunities to work in urban health and to collaborate. So thank you. Thank you so much, Baidi, for adding your email. Thank you for the link. I have also shared the link that Tiago was mentioning during his presentation. Thanks, Sydney. So moving on now to our second presentation, after which we'll have questions and networkings. We've prepared a mural for exchange. But without further ado, I would like to invite our colleague Ayanda Roji, who has a very bright career path. She's a social scientist who's been advocating for innovative participatory planning in different cities. She's currently now working in the city of Johannesburg on different public space projects. I've met her. She is very inspiring. She is the convener of different strategic partnerships as well on different boards, such as the World Urban Parks Climate Change Committee. She's on the board looking at how to make cities livable. She advises community officers in South Africa. She's trained in local and regional development, and we're very, very honored to have her today. To complete the presentation by Tiago, I invite Ayanda to present her talk. Thank you.
Thank you very much, Milan, and thank you to ISUH and partners for inviting me. It's so nice to be here. So I'm going to present my work around the Center on African Public Spaces, and also talk a bit about urban health in Africa and the age-friendly public spaces approach in African cities. Can you all see the representation?
So it seems like it's still charging on my side.
Can you see the presentation?
Still charging on my side. Maybe you can give it another double click. And if not, I can also load it for you.
Or maybe stop sharing and share again, because it may have opened in a different.
Okay. And now?
Yes, here we go. So you can, you can see your slides, but not in presentation mode yet. Now, yes, perfect. Thank you.
Okay. Thank you so much. And I'm going to talk about the Center on African Public Spaces a bit, and then I'll move on to the issues of urban health in Africa and zoom in terms of what age-friendly cities and age-friendly public spaces mean. So about the Center on African People's Public Spaces, CAPS, it is a joint initiative between the City of Johannesburg Metropolitan, UN Habitat Global Public Space Program, GIZ Inclusive Violence and Crime Prevention Program. So it was launched in a number of places 3 times in 2022, but the last time it was launched in Johannesburg. So CAPS was set up as a response to a call by African local governments who gathered in Morocco, and there was a call to set up a Pan-African knowledge exchange platform for African cities and other urban practitioners to advocate and mobilize around public spaces. I think African city leaders were lamenting the state of the cities, especially the loss of public spaces, and within public spaces, the loss of green spaces. So CAPS is a home and a resource hub to connect urban practitioners within cities and outside cities, like in different sectors, and public space advocates, activists, community groups dedicated to knowledge and learning around African public spaces. We work with community networks across the continent. So we draw from withdraw from their strengths, but also from their numbers, their members. So the issue really is to understand the meaning of public space in different contexts and climates. So there were a number of issues that were cited as problems. Number one is the fact that there's lack of documentation about African public spaces. I won't mention everything, but the important ones was the fact that planning and design practices, including policies in cities, are not progressive enough, or they still date back to the colonial era. So there was a need to develop planning practices, but also policies that are aligned to urban realities. And some of the university representatives, they lamented the outdated curriculum and thinking that hearing public space challenges and opportunities would be an opportunity to sort of connect what they are teaching in universities and what's happening on the ground. And then the last thing I wanted to mention is the fact that they are concerned about the loss of public space due to privatization. Really, there's a need to build consciousness of civil society organizations around the importance of public space. And then there were other issues related to public space that African cities are grappling with. The first one is the fact that public spaces, particularly green spaces, are not a priority in most countries, especially where informal activities are taking place. A second one is the fact that, yes, sometimes there is investment in public spaces, but many a times that investment is not adequate in terms of managing the public spaces. So there's a disconnect there, and that leads to public spaces not being safe places for people. The third thing that I want to mention before I move on from this slide is the short political term of office. So we have a big problem where, for instance, if I can cite the city of Johannesburg, we have one mayor that believes that public spaces are so important to have bike lanes and to extend pavements for walking is very important. Also for stitching a divided city like Johannesburg. And then after 5 years, you have another mayor that sees that as like a vanity project. So really the issue of short-term political of shortness in terms of political term of office is an issue in many African cities in terms of centering public spaces. And then the work of the center is structured or organized in terms of those 4 work streams. And you're welcome to go to our website to learn more about those. Today, I saw that the website is down, so maybe you can visit our website tomorrow. And then we have a vision and a mission. I won't go into detail, but I think what is important is that you are reimagining African cities that put at the center of their development quality and context-sensitive public spaces. And also in terms of our mission, is that we want to connect practitioners and other people in academia and so forth. Also, we want to connect practices so that we can, together as different sectors, start reimagining and advocating for cities that are filled with shared public spaces. And then I wanted to contextualize a couple of key factors in terms of considerations around urban health in Africa. The fact that we have a youth bulge, and we can see that we have a youth population with 60% of people under the age of 25. The issue is that, are we optimizing that? Are we harnessing that? The energy of young people in terms of helping us with the wicked problems that you have, for instance, our health issues. And then research shows, and I think Tiago says that we have made some successes in terms of life expectancy on the continent, And this means that while planning and trying to ensure that our cities have multiple sort of opportunities for youth, since we have a youth bulge, we also need to consider the future and the fact that young people of today will become part of the elderly population tomorrow, and hopefully with more advanced increases in terms of life expectancy. I just wanted to put a picture about South Africa. I think most people will be aware that our country has had a sad and tragic story around HIV and AIDS, and we have made such significant progress in terms of that. But we are seeing that more and more there's a real impact on South African residents and population in terms of non-communicable diseases, as well as injury and trauma that is attached to these diseases, meaning that there's a need to look at both communicable and non-communicable diseases. So how do we use the lessons that we have learned from HIV and AIDS in South Africa and Ebola somewhere and COVID in terms of charting a path or a journey around dealing with health and diseases on the continent that can be applied to more non-communicable diseases. And then I've put there obesity because it's a big issue, that and mental health in terms of our continent. What I wanted to say is that in terms of urban health considerations, we haven't really done like research in terms of urban health considerations, like scientific research, but we do have surveys that we do that show that urban health is very important. I mean, people are saying this. And what we did recently was to ask, excuse me, our members as CAPS in terms of like their thinking around urban health. And we have convened a group of people in the inner city in Joburg Park. It was 25 people last Saturday, and the conversation was around urban health and age-friendly cities. And the group was made up of people between the age of 20 and 67. So what we're hearing from people is that urban health is about the basics, the issues of limited access to adequate services such as housing, clean, safe water, sanitation, all those things that Thiago mentioned is about feeling safe in public spaces or in cities, and the issue of gender-based violence, which is like a huge issue in South Africa. We have heard also that it's about dignity. So one of the gentlemen, older gentleman, said that, listen, I'm sitting in this park, but I must make a choice whether to pay to use a toilet or to buy something to eat, because there was no toilet that was functioning in the park. So you have to go like a distance of 1 kilometer to access a toilet, and then you have to pay for it. And they also say that it's an issue of equity. We have 2 women that were staying in a shelter. They say, we wake up every morning because the shelter is for sleeping. So what we do is like we roam around the city, mostly in public spaces, or come to the park, meaning that we live in public spaces and we sleep in the shelter. So I think we've put the statistics there to show that in terms of urban dwellers in sub-Saharan Africa, 50% of the population live in informal settlement. So the importance of public spaces become an issue that needs to be highlighted for the urban poor. And the issue of equity and the access to resources and the basics that we talked about is an issue to be considered. And then we've put the slide around issues around public space, climate change, and urban health. I think here the issue around slums underscores public space importance, and the fact that for the urban poor, public space is like an extension of their homes. But again, COVID has shown us that public spaces are important and really essential as factors that sort of influence health, and also they are factors that influence health, and factors that influence health are embedded outside or within the environments, within urban environments. So these factors are like what Thiago has said, where people are living, where people are working, and where people are playing. So public spaces can really become important conduit to equitable access to physical activity, but also to healthy eating opportunities. So they have a potential in terms of producing increments in health. But we all know that there are opportunities, but also there are barriers in terms of that. So we see that in other countries, they are providing infrastructure such as bike lanes, sidewalks. We've seen that during COVID, countries adapting their cities and public spaces so that people can engage in physical activity. And this we have seen globally and also in other African cities. And this is to address climate vulnerability and also to enhance health. So as we're talking about these issues that are beyond just healthcare, we are grappling with the realities of climate change. So what is happening in Johannesburg, because we are experiencing extreme weather events, we did a study that looked at heat stress and vulnerability assessments. And here we saw that one of the research findings, higher extents of urban green provide like effective measures to mitigate heat stress and improve living conditions. And that is not a surprise, but the issue again is equity, how our cities are made up, how our cities are segregated and divided, meaning the greenery that we're talking about is important. We must think about where are these lush trees, we must think about where are these well-distributed parks, because we find that in our cities, they are in one area and you don't find in another. So that is important. And the infrastructure provision that we see globally, they are good practices, but sometimes they have limited relevance when it comes to our realities in Africa because of environmental vulnerabilities, especially because I mentioned that 50% of urban population in Africa live in slums. So I think what we're trying to say about this slide that shows CO2 emissions, and I didn't talk about that, but I'm preaching to the converted here, is that efforts to harness urban environments for health and climate resilience must be equitable. So they must consider also issues of access, and there must be consideration for the impact of climate change on health. So as we're wrapping the discussion, there was a talk about food, movement and air. I think it was a talk about healthy ways of of our forebearers, like the ways in which they used to live in the pre-colonial era, what food they used to eat, how they used to move and live closely with nature. Yes, in Africa we walk a lot, but we walk because we have to. Something that is hard if is an option because of how our cities are planned, our cities prioritize cars over people, so walkability is an issue. And it's good that we are seeing in cities like Lagos, they are starting to undertake walkability audits and also the research around air pollution and as it pertains to public spaces. That evidence, I think, is very important in terms of pushing urban health agenda and how that affects age friendliness of cities and public spaces. And then we ask the question, about age-friendly public spaces. What does that entail? We asked the participants. Well, they said it's about the standing items, the universal access, things that we've been talking about, things that we have not been addressing, you know. So as Tiago is saying that the value of the age-friendly approach is that if you're trying to respond to the issue of age-friendliness, you're also addressing issues around accessibility for people with disability and so forth and so on. And they said that it's about how we produce public space, making sure that public space is socially integrated. And I think Tiago showed a nice diagram around this. And the fact that we critique ourselves, the fact that sometimes we produce parks as just destinations or as projects, and or as projects that do not connect with anything. And I put the story of Mahosi, or image of Mahosi Letimile. She's from Cape Town. That's to show what Tiago was saying, the importance of integration and connectedness. So Mahosi story was documented by Marcella. It's about how she navigates the city of Cape Town in a wheelchair. She calls it a daily act of protest. So Mahosi lives in a 9-story building in Cape Town. She says that from the moment she opens her flat and heads down the corridor to the moment she reaches her destination, she's 38. She says that she's fighting a battle largely ignored by most fully abled people in the city. So I think the value of focusing on age-friendly approaches or integrating that is what we've been talking about, creating cities for all. And again, what we had is that age-friendly cities also is about safety and feeling safe in public spaces. The instances where public spaces are only made or occupied by a group of young men, how that sort of makes other people fearful in terms of accessing public spaces. And then it's about how we conceive public spaces, not just as physical constructs or as places of like accumulation, but also they need to be socially integrated. And also we must consider who uses the public spaces. There are public spaces that you can see, they were only designed for kids, lots of playground, nothing else. But we do have examples where the city of Johannesburg has done something right in terms of multifunctionality. Other people talked about the fact that they are not, their voices are not heard, they are not seen in governance processes, especially locally, is that they are seen as people who are, the language that is being used, you know, naming and framing, they are seen as vulnerable people, as people who are dependent. And that is problematic, the language, in the sense that we forget that they are valuable and they have contribution to make in society. I think that was so important. Also, it's about the lack of political will, you know. We need a political will to do better. We need to be bold, and also we need to innovate, because these are standing issues that we've been talking about for a long time, issues around accessibility and maybe issues around safety as well. And then within the city, if we're saying that who's steering the conversation or the policies around age-friendliness, you will be directed to social development. Yes, people lose social support as they age, but it's not only about that, you know, it's about losing income. So the way we look at cities, the way we make cities, it must be multidimensional. So I think to apply the lens of age-friendliness in terms of cities, we are pushing cities to mainstream how we look at health and also how we look at development, urban development in general. So we
Thank you.
talked about
Ayanda. Yes, thank you so much. Just a quick reminder on the time, because it would be nice to have
okay, I think it's just a second slide and then I'm done. I just want to talk about opportunities. Okay, so we talked about opportunities. What is it that we could do? The first one, it was around placemaking. How do we move from just a space and create a place that reflects our history, our culture, a place where people grow in, and a place where people belong. So something that the center, through one of our networks, placemaking, is something that we are going to take up. And then also to build spaces that allow intergenerational mix. There's a case of one of the parks in Jeppestown where older men said that they need platforms to transfer indigenous knowledge or cultural knowledge. And also, what is it that can be done is to adapt existing spaces using things like tactical urbanism. I think Tiago mentioned this, and also to program not just events, but think about strategic programming that sort of bring diverse people together, not only in terms of age, but also in terms of gender and other social identities. And there's a case also around that we can share. And again, listen to what people want about community engagement, bring older people in the conversation, bring them to the table. But we know that we've got limited skills in government in terms of doing that, because it's not just about bringing people to the table, it's about mobilizing people first, it's about finding them. And we can't just say that we're going to partner with old age homes. In Africa, we still like to live with our parents or grandparents. So it's a skill that is not there. But we realize that that skill is there, but it resides somewhere else within civil society organizations. So how do we partner with them so that they can help us to capture the people, older people's experiences, and also to facilitate these conversations? And then before I leave, the issue around private sector partnerships. So it's one of the things that we can do. We do have private sector partnerships, but they look at safety mainly around CCTV and stuff. So how do we think creatively about this and think about ways private sector can help cities to foster healthy environments and consider the role of older people within it. This is my last slide that talks about CAPS and how we are going to keep the discussion going. We are building a community of practice, and we've got different themes that we are focusing on. I'll just mention the one around urban health and the fact that we are working with Urban Better, which is a learning, collaborative, and advocacy platform that has been building a community of practice around urban health. And within urban health, we want to focus on age-friendly cities, but also we want to focus on health equity because it's an issue. Thank you very much. These are just inspiring practices. And as the center would love to start developing a compendium of inspiring practices around age-friendly public spaces. Thank you.
Great, very, very inspiring, Ayanda. Thank you very much for this comprehensive presentation covering the center and how it emerged and the gaps that it's filling. Right before I do a recap of both of your talks and open up the floor for questions and before the networking, maybe I would like to invite everybody to open the camera so we can do a souvenir photo to gift to our speakers. I think it's always nice to have a nice family photo of these sessions. So Yanda, if you can stop sharing, we can maybe do a quick photo. Hello, everyone, if you'd like to open your camera. I can recognize some names there. Trish, Charles, also some new urban health practitioners. Bailey, Danilo, Ozioma, Sarah, if you'd like to open your cameras, if possible. And we can do a nice photo. Should I shoot it? So I'll shoot it on 2, on 3, or 1, 2, and 3. Thank you very much. Nice mess. Great. So just as a quick recap, I think these 2 presentations were excellent. Oh,
Bailey just switched on.
Bailey, you put it on, so I'm gonna go again. So 1, 2, and 3. Great. Very nice to meet you all, and I hope you will stay for the networking after. So excellent presentations, very intellectually satisfying for me, and I hope for everybody else. There were 2 lines that I noted. Tiago, who said the first thing, we live longer, but do we live healthier? And then from Ayanda, are public spaces actually vanity projects? And I think these are quite interesting questions, but Tiago set out to globally map the approaches to age-friendly cities, showing us what are the priority sectors, what type of practices stand out. He made a very big point highlighting that for the moment, no African cities are currently in the network. And I think this is quite a big thing, and we should be in the race for adding an African city there. I'm first with Mauritius. It'd be lovely to see which other African city would like to sign up. Yes, thank you, Charles. And Ayanda then zoomed in into a regional approach to the topic, making a very nice case of how CAPS emerged and how it seeded from the gaps that we have, and pointing out that we should be able to learn from infectious diseases and the burden of disease that Africa now faces. I think one commonality that really hit me is that in both of your cases, whether it was global or regional, there has been quite a lot of consultation and convening and making sure that these voices are heard. And for me, this was quite big. And the second thing was around urban health being about the basics. It is about the basics and all the complexity that it carries. So I'd like to open up for questions, and the floor is yours. Please feel free to unmute, provide your name and affiliation if you'd like. Over to you. Yes, totally. I do have some questions as well while other people think.
Yeah, thank you both for the great talk. This is really great to see. Both of you alluded to, and Ayanda, you alluded to compendium, and Tiago, you gave some examples of, walkability. Is there somewhere, and maybe this is more for Tiago, where you're storing the tools that these different network members are using? So the people that did the walkability assessment, you gave that they walked with people. How do they do that? And are they sharing the tools just so that that resource is available? Is that part of the resources that you provide?
It is, Tolu. Oftentimes you will get that through the description of the practice itself, but also on the profile page of the member. Oftentimes they don't necessarily have it there, but my experience is that people are always very much open to share. And we see this energy happening a lot. If you're interested to implement some walkability audit programs in your city or community, then you can easily identify the 5 or 10 cities or communities that are actually running those and reach out directly. So long story short, some of those resources are already there, but I would, even regardless, I would encourage contacting people, because sometimes just having the resources is not enough. It's good. It's good to have an interaction with somebody. I'm sorry,
sure.
There's a storm coming up and all the windows are shown.
Okay. Now, I guess I think you're right that it's good to interact with people. I just wondered, maybe just to push back, whether it's something that WHO could do. So if you know that, okay, these are the kinds of activities, there's kind of 3 types of activities that people do. They do walkability studies, they ask about this, they ask about that, and to actually already pull that together and then say, these are the people doing it, reach out to them if you want to find out more. Because I think just to lower the barrier to exploring, so that if you don't have the resources to look through and find that, that could be something that might be helpful.
Definitely, Tolu. But I think that, well, there are two aspects to what you said. I think that we're not short of directories and resources. Question is how people make best use of them. In the case of the global database, actually the search is quite intuitive. You can filter by country, you can add a search term. So it's not something that it's that difficult for people to do. And I think that as important as the interventions themselves on outdoor spaces, on whatever, transport and housing, is actually this connecting. Because oftentimes what we see, and Ayanda referred to it, is that as important as the interventions is the process to get to those interventions. And this is at the core of age-friendly citizen communities. You see, nothing about us without us. So by facilitating these connections and having people talking to one another, you're also, you improve the understanding around not just what to do, but how to get to those results. And one last comment I would like to make here is that those interactions are usually quite helpful to overcome some of the preconceived ideas. I talked about resources, but one thing that Ayanda also mentioned in her intervention is about the government action. Well, I have to tell you, oftentimes, most of the action is initiated by civil society organizations, older people associations, academia. Several of the national affiliate programs were actually nested and born in academia through research projects that then become a national program. So yes, we do that on a regular basis. We bring people together, for example, with common interests. We facilitate those exchanges. But again, please, I encourage you to go there and interact with people, because you will get much more from than from any directory, any compilation that you may have in a passive way online.
Yeah, very, very interesting. Maybe Amy, you'd like to take the floor if you'd like to comment on this.
Thanks, Milan, and hi, everyone. This is a separate question. So Milan, I don't know if you want to comment on that specifically, or if I can ask another question.
Maybe I'll do a quick comment then. I think it's both Ayanda and Tiago. I think Ayanda, this is related to the activities and I would say the practices around. You showed these slides, Ayanda, of the inspiring practices. So my question for you is, what do you do with these practices? Do you store them, or do you think it would be beneficial for you, for instance, to have them placed on a database or repository, or related to the question that Tolu asked? And then on the other side, Tiago, maybe a practical question. How does one get a practice into your database of practices and to be able to make that a two-way process? Over to you, Ayanda, first, and then Tiago maybe to respond.
Thank you very much, Milan, for that. So at the moment, we have developed a template. We looked at various templates where like international agencies ask us for information. So we have this template from the World Health Organization, UNICEF, UN Habitat, all those, and we sort of adapted it. And the plan is to ask partner members that we are working with, that are working on different thematic areas, to document case studies. So once we receive that, we're planning to showcase the case studies on our website and crowdsource them and ask the public, do you have case studies relating to these particular thematic areas? For instance, where we are inclusive in terms of people living with disability, or where we are integrating informality in how we design public spaces. And maybe the World Health Organization, if we are looking at age-friendly spaces, could be like a partner with that. Because I was preparing for the presentation, at first I was like, oh, I don't think we're doing very well But then as I speak to people, there are inspiring cases out there. It's just that they are not connected. So it's an opportunity.
Great. Thank you. I can see the high achievers there. Tiago, over to you.
Yes, I will go back to that. Give me 2 seconds. I just need to shut the windows because there's a thunderstorm coming in and my house will get flooded. I'll be back in 30 seconds, okay?
Sure. Yes, Ayanda, no, very interesting, because I do think that we tend to sometimes focus a lot on the gaps. What is it that we're not doing? But then when we're doing really good things and there's good case studies, we don't necessarily focus a lot about disseminating them in a way that it can be used, replicated, scaled. And interesting that you go from choosing, getting templates for the WHO, and then we're kind of coming all the way around into submitting it back. I don't know if Tiago is coming back, but while he comes back, maybe Amy, you can ask your question. He's here.
So age-friendly practices. I submitted, I've just put in the chat box the form for somebody to submit an age-friendly practice. There you also have indication of what we mean by an age-friendly practice. It's relatively straightforward. We also have tutorials to support the submission of practices. You don't need to be a member of the Global Network to submit one. Actually, you will see several examples from civil society organizations, academia, so you actually can submit your practices even as an individual. People use those practices. We refer to them on our guides. People contact each other through the Global Network. And actually, I just got the confirmation that we will be supporting an international event on age-friendly practices in October in Sharjah, the Emirate of Sharjah, which is one of the Emirates of UAE. And most of the program, and actually the invitation to some participants, will come from the global database. Of course, we will focus on the ones that are more up to date. So once again, I do encourage you to submit those. At the moment, we have 0 practices coming from Africa. And I'm sure that it's not because it's our fault. It's not because we are short of innovative practices in Africa, as we've seen in Ayanda's intervention. It's our fault to make sure that people are aware and familiar with that platform and make best use of it.
Very well. Thank you very much, both of you. Over to Amy for her brilliant question.
Oh, gee, don't set me up. Hi everyone, and thank you, Tiago and Ayanda, for your presentations. I'm sorry I wasn't able to say hello properly earlier with connectivity issues, but hello. And yeah, Ayanda, my question is for you. I'm based in Cape Town, so it's very exciting to hear there's a South African initiative starting and going. I just wanted to get your insights on if you had advice for any other city in Africa, or if it's just South Africa, that's also fine, about what are the particular stakeholders that you find most important to start the initiation process or to start things off for this type of agenda and conversation at a local level. What has worked well to gain sort of traction and leverage? Like, do you have any advice if there is a city that's interested in starting with this? What would you say your first port of call needs to be to build a foundation for action?
Thank you so much. So I don't have a methodology really, but also I think it depends on the context. So I start with people, with friends, and I start with colleagues, and then I look at the partners that I have, and then I look at the sectors that are there. And I think young people, they have a lot of ideas, and they feel so marginalized, and they're so disillusioned. So most of the time, I work a lot with them around, like, what are they thinking about issues, even the issue around age-friendly spaces or approaches or practices, the distance between them and people who are much older, and issues around maybe if young people were part and parcel of local governance processes, that would have created a space for that intergenerational mix. So I start there and I look at different sectors. And one of the groups of like segment of society that I like to work with is the artist for anything in terms of ideation, in terms of approaches, and so forth and so on. But because I'm responsible for environmental education, the kids are so important. Because if you want to target the parents, if you want to target policymakers, those are the parents, you target the kids. So even if you're talking about the age-friendly practices, I think it's important to have like programs that are targeting children so that they can like pass the message to their parents, like who are policymakers, you know, and so I don't have a methodology really, but also it's looking at the gaps. For instance, in Johannesburg, we have a mayor today, tomorrow we don't have a mayor. So do you wait for like political leadership for you to do things? No. So look at what works, city practitioners, you look at civil society organization, maybe create a movement, and then when the city is ready politically, then you have something to sell, and then. Yeah.
That's really helpful. Thank you.
If I may, Milan, Amy, just a quick add building on Ayanda's response. Intergenerational activities is so fundamental. And my impression is that most of the innovative aspects around intergenerational activities, intergenerational solidarity will not necessarily come from high-income countries. For the reasons we know, for the way societies are structured, for the ways the communities are organized. So again, I think it's an interesting aspect that is critical for fostering age-friendly environments anywhere, but where most of the innovation will most likely be in places where communities are still organized differently. We are working on a guide precisely called Connecting Generations, which we hope to have launched by the end of this year, which will be also supporting the development of age-friendly cities and communities. Likewise, and again, that's why it's so important to have other parts of the globe coming in and providing their contributions. Ayanda mentioned a lot the issue in the consultation, repeatedly the issue of meeting the basic needs, coming out of those consultations, which is something that you do not necessarily get in certain settings. Right? In some other settings, people talk a lot about social isolation and loneliness, other aspects that may be less relevant. So again, trying to unlock and come up with solutions for things that matters in the context of Africa, or even sub-regions within Africa. Africa is big, can be quite useful for other places such as Latin America, Southeast Asia, or even Eastern Europe, where this topic is less advanced as well.
Yeah, great input. Thank you. Thank you, Tiago. We have a question from Natasha Berkowitz. Hi. I think we'll have maybe one other question after that before we go into the networking. So over to you, Natasha.
Sure. It's a follow-on to the discussion that's happening now, just sharing my experiences, and hello to all the familiar faces and the not so familiar faces. I'm from the city of Cape Town, work in the city health department, the public health clinician there. So yeah, just building on what Ayanda said, just sharing my experience about political engagement and will. Just in our space, it's essential to kind of have to leverage on political will, but I totally agree with finding your friends amongst the people around you to try and build whatever action you want to take forward, whether it's age-friendly city or whatever other intervention it may be, but also and so perhaps this is a fairly good segue into the networking, but if anyone's had experience with how to motivate with number one politicians, I think that's a challenge, especially when they're very economically driven as ours are. And then second, there's also what I find, and I'd be interested to hear from you, in the city of Joburg, there's a lot of territorialism with departments, and they don't really want to give up anything that they think is their personal responsibility. And so I've, even within the city health department, there's been a lot of territorialism around the word health, even though they completely subscribe to understanding that other departments are responsible for impacting the social determinants of health. They want to be the drivers of this change, which may not be the most appropriate thing in a service, in a department that's offering a service. So yeah, just about addressing the territorialism around those kind of things.
Thank you very much, Natasha, for these for this question, comment, sharing experiences. Maybe Ayanda, would you like to respond first and then over to Tiago?
Thanks. Thank you so much, Natasha. I think from my experience, yes, you're right. And that leads to like silo governance or silo approach in terms of working. But I find that you'll find a Natasha in a certain government department that you want. But of course, that takes time. You need to understand, the makeup of that department. So the way I've been working with departments is really about identifying another Ayanda, someone who's like, doesn't think, within a box. So it will be around champions. And then, that government, they've got these structures already set up that don't work very well most of the time. So I'll have my own working group targeting the departments that are important in terms of that particular issue. And I think sometimes it's not a matter of people don't want to be part of something, but it's just the value or the benefit or the linkages. What does age-friendly approaches or practices mean for me if I'm in transport? So I found that the minute you outline that, to say that this is your stake in terms of this, and this is going to benefit you, and use the KPIs, which is something that we like a lot, the key performance indicators. How is this related to my balance scorecard? So check the balance scorecard and say, this will help you or will contribute to you achieving your goals, that kind of thing. So this is how I've been working, but I've been so hopeful that I will get someone, or I'll ask someone else, do you know anyone in that department that is more progressive?
And I think what Natasha was mentioning, it's not an uncommon feature, right? It happens with different shades. It happens in many places at the local level, regional, national level. It's a bit of the nature of the work, and of course you have to find your allies within the structures. Sometimes it's more or less formal, but at the end of the day, you go with the coalition of the willing until you start creating this critical mass. And that is the same when it comes, for example, to the commitment to become more age-friendly at the local level. Well, what we've seen, for example, in Latin America was a sharp increase in the number of cities and communities joining, but it started with not a couple of cities or communities that saw the value in it, that had one leader locally, some structures in place, and a good collaboration across different sectors, government levels, but also all the stakeholders. And then once you have that and you start being able to create this core group, then things tend to expand because people start seeing value in it as well. One aspect that is particularly helpful in the age-friendly framework is that it's focused on people. So it's my experience is that it's also easier to talk to transport, to housing, to outdoor spaces, to employment, education, if at the end of the day we're all working to serve a population group. And in doing that, we benefit other population groups rather than coming with a very specific agenda, which has its value as well. But if it's too specific, then it's more likely that people will not see themselves in there. They will not see the added value of contributing to that activity.
Yeah, great, very, very rich discussions. Yeah, and important discussions to contextualize. So thank you very much for your questions and inputs, and I'm glad that we're recording this. We can safely disseminate because I find it very enriching. We have Tolu's here. Yes, Tolu, would you like to say something before I move on to the networking?
Yeah, no, I just wondered what do the speakers think about why there's this disconnect, because on one hand, Tiago says, it's, Ayanda showed that there's some things happening, but it doesn't seem to connect to the global agenda. Why is that? Because, given that this is a community of practice, because sometimes I find this is the big challenge, right? Things are happening, but they're happening in these pockets that people who know. And then you go into a different space and like, oh, there's this global network, or like, oh, well, all these things are not part of it. Like, what do you think why do you think this is? And so that we're not having to correct it every time. Like, why is it that, is this a knowledge asymmetry? Is this I'm actually just trying to think about why fundamentally we constantly seem to be in this position where we're saying, oh, these things are happening. How do we better connect it in? How do we ensure that when they're happening, they start happening and are better connected in from the start, because it might help accelerate action. I don't know if that makes sense. It's a more philosophical question.
And I think it would be interesting as well to, once our speakers respond, to kind of open the question to the room, because I do think we might all kind of have the same question and might have some comments to that. Yeah.
Maybe I can come in first, and I certainly do not have any definite answer here, just some reflections. I think as in any topic, there's a historical development, right? So there is a historical reason why population aging combined with urbanization is more or less relevant in certain parts of the world, right? If you look at the average population age of most African countries, it's quite young. So, and by analogy, you could also think of infectious versus non-communicable diseases, right? Non-communicable diseases we're increasing and continue to increase in many low and mid-income settings, but oftentimes you still have the mindset, the priorities, the allocation of funds dedicated mainly to infectious diseases. That is not to say that it's not relevant. It remains relevant. We have a double burden if you account climate change, triple burden. But I think changing the minds and hearts of people takes time. So there is an issue of awareness. Of course, here, many low and mid-income settings are in a critical situation, because while many countries had 100 years, 120 years to adapt for their demographic change, these countries and cities will have 10, 20 years. So the moment to act is now, but it's really good. It's really difficult also to act, to be proactive when you have so many conflicting priorities. So I think that one issue for us, in addition to awareness, is to try and highlight the multiple benefits that you can have by implementing such a strategy for today's problems, as well as for tomorrow's potential challenges if we don't act now. And then the third element, Tolu, I think, which we hope to start creating in this event and in many others as we advance together, is coordination. Because if you have a lot of activities, and we just saw the interesting activities that Ayanda presented And I'm sure that around this room we'll have many other, a lot of knowledge on existing activities, on research hubs, doing interesting, innovative stuff on age-friendly cities and communities, or you will have that government that is spearheading a lot of interesting stuff. You have that funding body, but this is not necessarily coordinated, right? This is not necessarily organized, aligned, agreed, and more or less walking in the same direction. Each of these stakeholders with their own interests, which is absolutely fine. So long story short, I think it's a bit of awareness, understanding the historical process, and coordination.
Thank you so much. If I can come in as well, I think it's the way people are taught. Like if you think about public spaces, the first thing people talk about is, or think about, is architecture, is planning. But public spaces is much more than that. It's like, I want your geographers, your sociologists, your anthropologists, and. And yes, if I can make an example around work in universities, they talk about interdisciplinarity, but I found that by building the center is so hard to practicalize, to operationalize. They talk about it, but they still work in silos. So issues around egos and logos, are still big issues. And again, also when it comes to government, is the issue of mainstreaming. For instance, I went to a meeting whereby we were asked to assist a politician who was attending a conference around healthier cities or building healthy cities. And everyone was talking about clinics. It was mostly Department of Health and Social Development. And then the question is, what did COVID teach us in terms of, connecting and interconnectedness of issues, of complex issues that we are grappling with. So I don't have an answer to that, but also it's about personally how people collaborate. And again, I think, Tiago, what you said about seeing the multiple benefits of collaborating, because collaborating and making sure that your work makes sense to maybe a cleaner is hard work. Same as community engagement is hard. You spend a lot of time, but it's very important.
If I may just quickly add, because Ayanda's comment was inspired me to think of one additional aspect that may be influencing. So capacity building training, it's critical. It's how we train these different professionals, these politicians, and all this is critical. But also the framing. See, we're just having some conversations with colleagues around long-term care. Long-term care, in most places, means in people's minds, institutionalizing older people. They don't think about long-term care in terms of aging in place, ensuring that people live in their homes and have access to their outdoor spaces as much as they want. They don't think about the community of care and the care of the community around an older person, for example. So even within those that are, amongst those that are already somehow knowledgeable in these different aspects, the framing is really important. You may be doing age-friendly work without knowing it, or you may be doing long-term care work without knowing it. So there's also an issue of framing and positioning the issue in a way that resonates to what people are already doing that contributes to their agenda.
If I can just come in, I also just wanted to add that the concept of framing is so important. And I think for me, the one thing that stood out from what Ayanda was saying is how these short political terms of 5 years, at least in South Africa, but for many African countries, do also create this challenge. But also just, this is actually an opportunity to shake things up a little bit by saying, do we know that within the next 30 years, the 80% of people will be living in cities, and also that means it's a 30-year cycle, which means your youth of like 25 years old will be 55, and that means you have 6 mayoral cycles to get things right. 6 mayoral cycles, and that is it. That's when your youth bulge is now entering your aging population. And so can we like shake up the ground a little bit by actually putting this and making it something that will be so relevant for anyone? So I just thought I'd throw that out.
I'm also going to jump in here quickly because I'm going to have to leave the meeting shortly. But also, just to respond to this conversation, I think some of the barriers, Tolu, is culture within organizations. And so, it really depends on the culture of the organization, how you approach challenges, how you approach issues. And if it's just a culture of tick the boxes and do the job, then you really, you're not going to reach out, you're not going to collaborate and do all these things that we're talking about. I'm looking at our city values on my desktop here now, and it talks about innovation and accountability and transparency and all these things, good things. But is that really shaping the culture of the organization? And then perhaps also to add, a lot of the, we're all experts in this room, we're all specialists in our field, and I think when people hear us preach or talk or engage, they almost think, let's leave it to the experts, and perhaps we actually need to be less specialized and engage it. Well, I don't know what the word is or how to do it, but bring in less specialist people into the health space, so that we think outside of our frameworks and our, etc., and just attack problems as innovative thinkers, rather than health specialists. Yeah.
Great. Using the expression, anybody else wants to come in? Yeah, I think it's a great question. And if I would add anything more to all these lists, I think it would be about strategically planning, to bridge that gap. And I think that demands time, framing, deciding on the common language, restructuring strategies, aligning priorities. But it all builds up to, if I'm doing something and I'm strategically planning to put it in the global database for practices, and I'm strategically planning to disseminate it at local level, and I cater for that space, it makes a huge difference, in addition to all the different factors. So thank you very, very much for these comments. We still have another 15 minutes or so catered into the meeting just to meet each other and maybe talk about more, maybe for those who haven't talked yet, and I don't want to point fingers because we're such a small group, and I know Natasha's leaving, and Ayanda and Tiago have spoken a lot. I would like to invite maybe other people who are on call, Parnian, Leah, Bailey, Trish, to kind of maybe provide their insights or how they felt about the session. If they'd like to bring some experience to the table, I'm sure we'll learn lots from you too. Over to you.
Well, hello everyone. I'm sorry that I didn't introduce myself, and I must say that I wasn't fully connected for the whole session. I'm Leah Bloom. Mostly Sydney and Ayanda know me. I work for ISUH, and I'm a project manager for the Accelerating City Equity Project. And we are, this is a project that is a 2-year-long project. We're in the 2nd year of the project, and we are organizing a series of in-person meetings this year and activities that build on cases that we have been studying and learning about that advance city equity across the world. So we are actually restructuring our approach to the African region. And I just tried to tune in. Ayanda had told me about it because we're trying to engage the Center on African Public Spaces in the ACE activities. And I just tuned in to listen mostly. I arrived late, and then I had to go off and connect again. I'm sorry that I couldn't join the full session, but it's a pleasure to see your faces and hear you and see in a way that I know that the topic was about age-friendly cities, and I've been acquainted with the Age-Friendly Cities Network since 2019, Tiago. I got to know Tina Buffet. Maybe that's her name. I think she's a researcher. She was working on that. I met her in Manchester at a conference on Greater Manchester, was working back then very strongly in aging differently in this project, and I have been working with local governments for many years. But well, it was very nice to see how the network has evolved in the past year, and that is strongly still there. And I am very pleased to see you and be connected, and I hope to hopefully eventually send you news and contact you with the activities of the ACE project that we are organizing, also in the framework of the International Conference on Urban Health. So more to come soon. And yeah, that's pretty much it. I'm sorry that I couldn't go too deep into like the debate of content, but it's a pleasure to see you. And I think Thiago, you're Brazilian as well, and I'm Brazilian. You can probably notice my accent. I watched a webinar of yours when I was working for Metropolis. So I think I used to work for the World Association of the Major Metropolises, and I think you joined a podcast a couple of years ago. So although we haven't met, I've heard you before, so I'm kind of acquainted. Also to Lula. So it's nice to hear you and be lively connected with you. And I hope although it's a little bit clumsy, this presentation of mine, I hope it's just the first acquaintance and that we can keep in touch in the future. Thanks a lot.
Nice to meet you, Leah. What countries are you working in with the ACE at the moment? Where did you decide to?
Yes, restructuring the activities. It's a different approach this year because we want to bring more organizations. Well, basically, it's creating again network and like building on the networks that already existed as well, of course. So in the first year of the project, there were many online meetings and individual collaborations where these were super helpful for us to develop this bulk of knowledge and case studies. But now, so that we can have more people on board working, we call like everyone, I think, working on urban health as well has the great potential. You're already, what we call city equity accelerators. So like bringing more people on board and getting to know about maybe real cases and real experiences and processes on how we change and how we design public spaces that are for everyone, for all ages, and mostly in most vulnerable groups. I think this is very important.
Leah, great to meet you. Excellent. Wait, it's excellent to know. I am quite familiar with the project. I didn't know that you were now working on it. I think that this is a great example. We talked about how we highlight the multiple benefits, right? So here's a concrete suggestion. In projects like this, we not just want to highlight what people are doing to address equity, but we want to try at least to institutionalize structures at the city level, at the local level, just so that something can be left once the project funds are gone, right? At the same time, the framework for age-friendly citizen communities has been proven to address equity in many ways, not just for older people, but also for the reasons I've just mentioned. It supports persons with disabilities, living with dementia, and so on and so forth. And actually, both for disabilities and dementia, the Global Network is the implementation mechanism advocated for in the action plans of the organization. So just a thought, why don't we try and use this different way of looking at the African context to try and push for having the cities involved in the project to also commit to become more age-friendly, because then you secure political commitment that at least will help people like Ayanda, like Natasha that's just left us, to have the mandate to carry on, to take the flag and continue the work. And then you mentioned Tina. Tina, again, and this is for all the researchers in the room, I still wear that hat, even though I'm not doing research, I'm mainly commissioning it these days. Tina Buffo and the colleagues from the University of Manchester, they have extensive experience in the co-production of knowledge, co-production of research with all the people in age-friendly spaces. So again, a concrete example of how we, and again, Natasha mentioned it, no? How we bring these people to develop research, knowledge, action with us. Right? They should be in the driving seat. They should be leading the agenda. But of course, we need to have a methodology, tools, and examples to be able to do that and to adapt to our own context. So I do encourage you also to have a look, us all, to have a look of the work that the colleagues in the at the Manchester University are doing as regards to the co-production of knowledge with all the people for age-friendly citizen communities.
Yes, great. Thank you. Thank you very much for opening up your mic, Leah. I know Panyan is in the field, so thanks, Panyan, for joining. I don't know if Bailey wanted to take the floor before we close up the session, because I feel like everybody has spoken. Trish just left us. I can see a message in the chat. Yeah. Okay. Well, I mean, I do think that these conversations were very helpful for us to look at different dimensions of age-friendly cities. We touched upon different things, you know, what age-friendly could mean, what does it mean across different contexts, but also within different sectors, and what are the challenges that we're facing today in terms of aligning activities, in terms of considering timelines and intergenerational timelines, I would say. I mean, I've been very impressed by the talks, but also by the comments. I do think there's a lot of opportunities for future action. One of them is, of course, to just continue working, but more than that, highlighting what is being done and what are the success stories and how we can actually learn from each other. So I think it's a very nice and hopeful note on which we can end. Maybe I would like to invite any of you, if you'd like to add some last comments before we move on. I did want to highlight that we have a newsletter, and Sydney, thank you so much for supporting us. And in our newsletter, we do a spotlight. So if you know of anybody or any topic that you'd like for us to highlight, feel free to either say it now or shoot us an email. So that's over for me. I think on my side moderating, it's been a pleasure. Over to you.
You're handing to me?
Oh, anybody.
No. I think that's it. Thank you very much, Milan. And thank you to our excellent speakers. It's been really great. And I think the idea of this is that these are not once-off standalone things, but that we're building a body of conversations over time, which is why we're recording to look at what the footprint of urban health practice, policy, and research is looking like on the continent from these really critical topic areas that are crowdsourced from the community. So thank you for sparing the time to share your thoughts and expertise and experience, both the speakers and everyone in the room with us. And yes, so do please let us know. The next session is when it's ready. And so this is not preordained. So we will reach out to the community, say, what would you like to hear about next in the coming few months? And if you have any suggestions, or if you would like to speak, or you have a partner that you'd like to kind of have a duo with, that would be great. So with that, I think thank you all very much, and see you next time.
Thank you.